Hi everyone, in today's video we're going to talk about vitamin K and why a vitamin K shot is commonly given to newborns. Hi and welcome to this evidence-based birth video all about vitamin K in newborns. My name is Rebecca Dekker and I'm a nurse with my PhD and the founder of Evidence-Based Birth. Today I'm going to answer your questions, what is vitamin K and why is the vitamin K shot routinely given to newborns? Vitamin K is a fat-soluble vitamin that's needed for blood clotting. It's named after the German word for clotting, coagulatione. We can't make vitamin K ourselves, and we don't store it very well in our body. We have two main sources of vitamin K. Vitamin K1 makes up 90% of our overall levels of vitamin K, and it primarily comes from leafy green vegetables such as spinach, kale, collard greens, and Brussels sprouts. You can also get vitamin K1 from cauliflower, turnips, avocado, banana, kiwi, and soybean oil. Vitamin K2 comes from bacteria that live in our digestive tracts, and that makes up a smaller portion of our overall K levels, only about 10%. Vitamin K is needed to activate certain molecules in our body called clotting factors. When a baby is born, they have clotting factors present in normal numbers, but they're not fully activated yet due to a lack of vitamin K. If a baby does not have enough vitamin K, they cannot activate those clotting factors, so a deficiency in vitamin K means a baby's blood is less able to clot. For the most part, an infant's blood will continue to clot appropriately even if vitamin K levels drop. However, if vitamin K levels get low enough, an infant can suddenly reach a point where their blood can no longer clot and they can start to bleed spontaneously. The level that the vitamin K has to get down to in order for the blood to lose its ability to clot varies from person to person. And this type of vitamin K deficiency bleeding is completely unpredictable. It's not related to trauma or falls or dropping your baby or any kind of injury. So now you might be asking, but why do babies have low levels of vitamin K? Well, at birth, we do know that babies have very limited amounts of vitamin K. Their vitamin K levels are lowest on days 2 to 3 of life, and they won't reach mature levels of vitamin K until 6 months of age when they start eating vegetables through solid foods. There are 3 main reasons why babies do not have enough vitamin K. First, very little vitamin K transfers from the placenta to the baby during pregnancy. Second, newborns do not have enough bacteria living in their intestines to make enough vitamin K2. And third, there are very limited amounts of vitamin K in breast milk. If you really want to dig into the why are babies born this way? Some people get really hung up on this topic. We do go into a lot more depth on our podcast and full-length signature article on vitamin K that you can find at ebirth.com/vitamin K. So for a baby, if their vitamin K levels get really low, this means that the baby could start bleeding suddenly without warning, and this is called vitamin K deficiency bleeding or VKDB. Vitamin K deficiency bleeding can be idiopathic, meaning it doesn't have a cause or there's an unknown reason why it happened. And virtually all cases of idiopathic VKDB occur in babies who are exclusively fed human milk. VKDB can also be a secondary condition, meaning that there's an underlying disorder that is causing the vitamin K deficiency. This is even rarer than idiopathic VKDB, and it might occur in babies with underlying conditions such as very rare gallbladder disease, which affects 1 in 20,000 babies, cystic fibrosis, or due to medication side effects. However, most babies who have secondary VKDB are also exclusively fed human milk. On the other hand, babies who are formula fed almost never develop VKDB because formula is highly fortified with vitamin K. Now, vitamin K deficiency bleeding can follow one of 3 patterns: early, classic, or late. Early VKDB happens in the first 24 hours of life. It's usually seen in babies who are born to parents who took medicines that interfere with vitamin K. With early VKDB, the baby may bleed in their brain, skin, or abdomen. Classic VKDB, sometimes called classical VKDB, happens in days 2 to 7 of life. Usually, though, during days 2 to 3 when their levels of vitamin K are lowest. The main risk factors for classic VKDB include exclusive breastfeeding or if the baby is drinking insufficient milk. With classic VKDB, the baby may bleed in their digestive system, their umbilical cord site, their nose, or their circumcision site. Classic VKDB tends to be milder, but significant blood loss can occur. Late VKDB happens after the first week of life, usually during weeks 3 to 8, but sometime before 6 months. VKDB also happens in babies who are exclusively breastfed and did not receive supplemental vitamin K. Some babies may also be at higher risk for late VKDB if they have undetected gallbladder disease, cystic fibrosis, chronic diarrhea, or antibiotic use. This type of bleeding usually occurs in the brain, the skin, and the digestive tract. Bleeding in the brain is often the first sign of late VKDB. Because of this, although late VKDB is rare, it's considered the most dangerous type. Researchers actually discovered way back in the 1940s and 1960s that by giving a dose of vitamin K shortly after birth, they could prevent cases of bleeding and death due to classic and late vitamin K deficiency. So, studies have shown that if babies do not receive any vitamin K at birth, about 0.4% to 1.7% will experience classic bleeding or bleeding that's occurring on days 2 through 7. However, care providers are usually more worried about late vitamin K deficiency bleeding because the first sign is often a bleed in the brain. There's no early symptoms where you can detect it before the brain bleed occurs. Here's where I'll share some statistics with you so you can see the actual numbers and how rates of vitamin K deficiency bleeding have gone down over time as they have started using different types of supplemental vitamin K. When infants do not receive any vitamin K at birth, statistics from Europe show that 4.4 to 7.2 infants per 100,000 will develop late VKDB. However, rates are higher in some Asian countries. For example, in Thailand, they reported rates as high as 72 infants per 100,000 when they were not given vitamin K. When infants receive 1 to 3 milligrams of oral vitamin K once at birth, anywhere from 1.4 to 6.4 infants per 100,000 will develop late VKDB. When infants receive 1 milligram of oral vitamin K drops at least 3 times during infancy, typically at birth, 1 week, and 4 weeks, about 2.6 infants per 100,000 will develop late VKDB. When infants receive 2 milligrams of oral vitamin K at least 3 times during infancy, typically at birth, at 4 to 6 days, and at 4 to 6 weeks, or if they're given 2 milligrams of oral vitamin K after birth, and then 1 milligram of oral vitamin K drops every week for 3 months. Statistics from Europe show that somewhere between 0 to 0.9 infants per 100,000 will develop late VKDB. However, the shot has the highest success rate. When infants receive the vitamin K shot at birth, anywhere from 0 to 0.4 infants per 100,000 will experience late VKDB. The vitamin K shot will not prevent every single case of late VKDB, but most countries report incidence rates close to 0 or even 0. Many of our followers are interested in the oral drops, which are a valid option, but unfortunately not every country has licensed or regulated oral vitamin K drops for infants. For instance, in the United States, there is no FDA-approved version of vitamin K oral drops for infants. Some people may buy oral vitamin K drops from a food store, but there is no inspection or verification by a third party to ensure that the actual dose that's being advertised is what's in the bottle. So what's the bottom line on vitamin K and the vitamin K shot and oral drops? Well, the bottom line is that babies are born with low levels of vitamin K, and late vitamin K deficiency bleeding can almost always be prevented by giving supplemental vitamin K after the birth, either in the form of a single vitamin K shot or through regular administration of oral vitamin K drops. Many decades of published research has shown that the vitamin K shot is the most effective form of vitamin K treatment available for babies. The only known adverse effects are pain, bleeding, redness, and bruising at the site of the injection. The good news is that out of many millions of injections that are administered annually around the world, there has only been one published report of a serious allergic reaction in recent history that happened in Turkey in 2014. Some parents may be concerned about discomfort during the shot. Holding your baby skin to skin or nursing them while they're receiving the injection has been shown to reduce pain. Witnessing that your baby actually receives the injection is also important, as there have been rare cases of the shot being documented in the medical chart but not actually given by providers. Some parents who are hesitant to accept the vitamin K shot may prefer an oral drop regimen. There is currently no FDA-approved version of oral vitamin K droplets for babies in the US. However, there are countries where oral vitamin K drops are available, and in those places, research has found that this can be a highly effective alternative way of preventing VKDB. If your baby is receiving oral drops instead of the shot, you must pay careful attention to ensure that they are getting the dose close to a feeding because it needs fat to help with the absorption, that they receive the entire dose. You gotta make sure they don't spit it up afterwards, and that they received all regularly prescribed doses. Some oral regimens are more effective than others, and you can learn about the different regimens at ebbirth.com/vitamin K. So that wraps up this video all about vitamin K and why it's commonly given to newborns. Make sure to leave a comment below this video, keep the conversation respectful, and give me your thoughts. Also, once you've done watching this video, you can head over to ebbirth.com/vitamin K and check out this free one-page printable handout that we made for you all about the evidence on vitamin K. And if you have questions that were not answered, they might be answered in our hour-long podcast episode on this topic that you can find right here on YouTube, and we'll link to that below as well. Thanks everyone, and I'll see you next time. Bye!